Yesterday, Italy passed a record high of 3,000 COVID-19 recoveries in one day. According to the Italian Ministry of Health, Italy has been on a 3-day consecutive decline in cases. On Tuesday, the Italian Prime Minister said the easing of lockdown restrictions scheduled for May 3rd would be gradual. Joining us now is Dr. Andrea Cambieri, medical director at the Gemelli University Hospital. It's one of the main COVID-19 treatment hospitals in Rome. Doctor, thank you so much for joining us. Can you give us an update on how the doctors and the nurses, as well as the patients, are doing right now?
Now we are getting better, but at first it was really hard when we were attacked by the virus, and we had to react, to counterattack, and to convert the entire capacity of our hospital, which is a big hospital, 1,500 beds, into an infectious disease hospital. Mostly, we had approximately 1/3 of the hospital occupied by patients affected with this virus. And so we had to dedicate operating theaters, machines, trucks, all to this kind of situation. Now we are entering phase 2. The country is going to reopen certain activities, exiting from lockdown and reopening shops, circulation and factories. So we will have possible risks, and even in the hospital, for a possible second wave of the virus pandemics. So we will have to be very cautious, monitor the patients, especially the outpatients, when they enter the hospital.
Doctor, can you talk about some of the challenges that you've been facing and maybe some of the accomplishments when it comes to fighting this virus?
The first challenge was the need to be extremely quick in reacting and counterattack. The conversion of logistic areas of the hospital and procedures in entirely different areas and activities and procedures. We were trained because we had a crisis plan, and we also were skilled on pandemic plans, but we didn't expect such an intensity of attack. So the leadership and the logistics and the unity of the staff was fantastic and necessary for dealing with this topic.
You mentioned that Italy is getting ready to open back up again. Can you talk about maybe the virus, if it could maybe so-called retaliate, and if we could live with the virus?
If it's going to retaliate, I hope it will be later, the possible second wave in autumn. In that scenario, we are able to redo what we have already done, although we hope to a limited extent. The entire hospital network in Italy, in this region, was converted and had to react rapidly. So we are not drawing back. We are just putting the system in pause and maintain capacity in order to deal with what we think will be continuously arrival of patients with infectious disease.
Do you have any advice for other doctors and healthcare providers who are battling this virus right now?
Yes, we are continuously meeting. We have meets by television or calls with other hospitals, colleagues, especially in the north of Italy. They were struck with an intensity which is not comparable to the one we faced here. The system in the north of Italy, Lombardy, Milan, nearly collapsed. So we had to learn. We had to learn from that experience. We were lucky to have some time between their being attacked and us. In those weeks, 1 or 2 weeks, we built up the reaction.
Well, Doctor, thank you so much for your time and your insight and what you're doing. We appreciate it. Dr. Andrea Cambieri, Medical Director at the Gemelli University Hospital. Thank you again.
Thank you. Goodbye.